Welcome to our podcasts. I, Health I See Tomorrow. I am Zharqyn, and today we tackle a big question. Will robotic technologies replace human jobs in healthcare? I'm here with my co-hosts, Dias.
Hello, everyone. It's a pleasure to be here. This is a topic that affects all of us, including doctors, nurses, and IT specialists.
That's right. Today we will look at the causes and the consequences of this automation. We will discuss the risks of job loss and also the ethical issues like human touch, and finally the solution and new opportunities this technology creates.
To start, let's quickly describe the context. When we say robotic technologies, we mean more than just physical robots. It includes AI and advanced automation being used for things like like analyzing X-rays, managing patients' records, or even performing precise surgery. It's rapidly changing landscape.
Uh, that sets the scene well. So let's get straight to the biggest concern. Beyond just freeing up to a few hours, how realistic and is the fear that robotic technologies and the AI will lead to this widespread employment and also for highly routine healthcare roles like medical transcriptions, coding specialists, or certain lab assistants.
Yeah, that's a fair question, but I think the language is important. It's less about replacement and more about retasking. Yeah. Studies suggest that AI automates tasks and not whole jobs. For instance, a lab assistant might spend less time counting samples and more time analyzing complex results of dealing with difficult patient cases. Job will change, not vanish entirely. It's opportunity to focus a high value human work. Speaking of improvements, let's look at the positive side. In what specific high stakes tasks like surgery assistant or rapid disease diagnostics do robotic technologies offer a clear, undeniable improvement in quality and efficiency over human labor? Isn't that the ultimate goal for the patient?
I can't argue with safety. A robotic surgeon, for example, has far more precision than a human fat, and the AI can diagnose some conditions faster than a doctor. Also, we show that they are fantastic tools and they reduce human error. However, we must remember that a machine can handle uh, an unexpected. Also, they lack that general knowledge of a human doctor to see a situation outside of their programmed data. Let's move to the ethical side. In a field that requires empathy and trust, what is the greatest ethical risk, and what is the ethical risk of replacing jobs that involve a high level of physical or social contact with a patient? Can a machine truly build trust?
Yeah, I agree that we cannot and should not automate empathy. The goal is to use robots for the routine, non emotional works. If AI handles scheduling and basic ad- administrative tasks, it actually free up human staff to spend more time providing the emotional and the personal support that only human can offer. The risk is if we mismanage the technology and try to force into roles where human connective is vital. On a related note, one of the big challenges is the fairness. If AI systems are trained on the historical patient data, which often reflects past the systematic biases. How can we prevent this technology from the perpetuating or even worsening healthcare disparities and the unequal access to care?
That is a huge problem. Garbage in, garbage out, as they say. If the data only represents of one group of people, the AI will fail to diagnose or treat other groups correctly. To fix it, we need strict oversight and diverse teams building and testing the AI models. We need ethical guidance, and before we put this technology into widespread use. Now for the solutions. Since this change is already happening, what's proactive strategies or policies should institutions adopt to manage the transitions, also for workers whose routine tasks are automated? What do we owe? What do we owe these workers?
The key is investing in people. We need mandatory retraining programs for all affected staff, teaching them the new skills for human machine collaborations like operating the robots or managing the AI system. Some people even suggest a robot tax on companies using automation to fund these educational programs and social safety nets. To close our discussion, based on the everything we've talked about, the pros, the cons, and the ethical dilemmas, what's your final takeaway? Is the future of the health IT workers one of more fear or more opportunity?
Honestly, it's a mix. There is immense opportunity for efficiency and saving lives. But there is a real fear of being left behind for many workers. Mm, it is a responsibility of government and the hospital to manage this change ethically with clear rules and a focus of upskilling every employee. That brings us to the end of our discussion. We are worried that robot technologies are unlikely to replace entire human jobs, but they will certainly transform them, moving the focus from routine tasks to complex, emotional demanding, and also supervisory roles.
Absolutely. The future of the work in a health IT is not a human versus machine, but the human and machine. We must ensure that the prioritize ethical use, minimize bias, and invest in our workforce through the continuous training.
Okay, thank you for sharing your experience, Dias.
Thank you, Zharqyn.
And thank you to all our listeners for tuning on. If you want to share your thoughts on the future of IA in healthcare, please leave a comment below and don't forget to subscribe for more episodes of Health IT Tomorrow. Goodbye.